abnormal heartbeat. And it depends upon your skills. Either you can judge the heart murmurs. It depends upon your expertise. Either you will judge the normal rhythms or abnormal rhythms. And then we will go for its GIT track. GIT track. First of all, you have to ask about the owners about the vomiting or any diarrheal history. If the owner or the handler give you any history about the diarrhea or history about any vomiting, you will suggest that there something wrong with the GIT, maybe gastroenteritis or any other disease. It's like if the puppy is like issue of the worms, it's a issue of the any protozoal bacterial disease. And then we have to check for joints. Or the joints look motion as range in full range. Check for the examination for the joints and shoulder joints, elbow joints, pastern, and then we check for all the legs. All the legs are normal in the position, or joints are normal. The most important is the lymph nodes. The lymph nodes, like the first lymph node is and between the jaw maxillary is the submandibular, maxillary, parotid,